soon maybe we could redefine the approach of physical therapy or rehabilitation solution. Okay, I've been a physical therapist for 20 years. I graduated from University of Maryland and I'm practicing physical therapy in California. And I'm still practicing physical therapy in California as an independent contractor doing home health visits. Okay, while we're waiting for the slides, I would like to ask a couple of questions. Like, if you were given patients like stroke that requires maximum assists, how do you make it happen? How do you actually do the gait training with a maximum assistance of a heavy patient that has like a massive stroke?
In our setup, we don't have big beds and all that, so we use a transfer bed around the patient to carry him or to transfer him from bed to wheelchair and all that. So that's the maximum thing we have.
We do not give gait training to people who are totally dependent on caregivers or the therapist. We don't have the ability to lift them and put them in some frame or sort of.
And do you think that if we are able to, if all our minds are able to put together and craft something like a robotic or an engineering type of equipment that will provide the lift, do you think that will be received well in the practice?
Yeah.
Yes.
Okay. When you see this concept, I hope that you will be as excited as I am, because being a physical therapist like yourself and practicing it in different environments, I have been exposed in various clinical settings like rehab, nursing homes, subacute, outpatient clinic. Lifting has always been the stumbling block, right? And because we only have one spine, we only have one back, if it cracks, there goes our income. So, okay, thank you. Kevin? When you see a patient that has a rehab potential, but it requires 2 to 3 people to assist, there goes the opportunity, right? So you're just training for transfers, and that's it. And you're not able to establish any more rehabilitation goals for the patient, correct? So what happens when they're discharged home, they're just like wheelchair bound, bed bound, or you compromise their mobility, even if in your clinical expertise you know that they have rehab potential. So that's what we want to correct here. And I really hope that, because we are leaving this equipment for you guys, and I want you to like really be as excited as I am, like really engage yourself in using this, in whether you get a patient who's neurologically challenged, or maybe it's like an orthopedic patient. You will have an appreciation as to how this works as I show you the slide. And feel free to interrupt me if you have any concerns or questions. Are you guys on any time constraint? Because what I plan to do is I want to give the theoretical, the conceptual knowledge base, and then we are going to go to the department and have a hands-on and an experience of that equipment. But no. Okay, all right. Where's Kalpesh? Okay, I would like to introduce the important players behind all this. Kalpesh, Harsha, and you have met Kevin. So without them, my idea is nothing. All right. What sort of patient caseload do you get here? Do you get a lot of stroke? Okay. How about multiple sclerosis? Amputees? What's the majority? So I'm really, really very excited because if you are going to be able to get those kinds of candidates, we're going to really be able to use this equipment, and let's gather data so that we can really develop important information for the academic research to make it really a validated equipment. Ready? Okay. The equipment is called the in-home gate. Okay, the in-home gate frame. That's me. Okay. Now, this will be our topics for the day, and I hope I won't bore you. Okay. Now, just real quick, this is the in-home gate equipment that we have put together that will, just like I said before, hopefully we can redefine the approach of rehabilitation solution. Because for one, lifting is a difficult problem. It's always the role of the physical therapist, caregivers, nurses, and family members. Number two, documentation. So you will be very excited that we are not only offering an equipment, but an e-patient chart. So whatever we're doing with the patient, real time, the data and the information will also be transported into an e-chart. It will be accessible through iPad, iPhone, any tablet. Okay, so currently what we're doing is we try to commit it to memory, and then we go to our patient with our desk, and then document what we have provided for the intervention. And then the third is the customizing of therapeutic exercises. So with this equipment, later on you will find out that the physical therapist will have the ability to really customize a therapeutic exercise that is specific to a muscle disorder or specific to a medical condition. And you will see that there is camera. So the camera will be able to record the patient's activity. Okay, and we do have vital sign sensors and body sensors. It is not available right now, but eventually, we will include that in the, in the package. But those are the capabilities. We have a remote control. You will be able to play around with the remote control later on, but it's not going to scare the patient, because ideally, the way this machine works is the patient is in a wheelchair or in a regular chair, whether maximum assist or an amputee, it will basically lift the patient up with a harness safely, okay, brought it up to an upright, erect position, and once the patient finishes the session, you can lower the patient down safely back to the wheelchair. Or if there's like any panic or dizziness or fainting, you can just lower the patient and stop the session. Okay, so that's the remote control. And the body harness I also designed where it would allow circulation on the lower extremity. So even if the patient is like really wobbly and no strength with the muscles, the padded strap will help continue the circulation without really, adding pressure. And we will have a loose bottom strap here, so in case the knee buckles, there will be an additional safety support for the patient. And also it's a Velcro strap, which would address the weight, because what is out there in the market is like really heavy, harness because of the metal and the buckles. But with the Velcro strap, one additional thing that's good about it is when the patient has a big abdominal area, it can be adjusted, or when the patient is tiny, it can be adjusted to a snug fit. And, okay. Now, so this machine is capable of treating a patient, huge patient, 260 pounds, 6'6", okay? And it will allow the patient to step forward, step backward, step on the side, left and right, 1 foot on all 4 sides. Just like what I have said earlier, these are the important parts in the gait frame. The lift mechanism, the hanger, electronics box, remote control, and we have the wheelchair ramp, okay? This is Dr. Raj's favorite. Like the wheelchair ramp is, it's a portable gadget where you could actually wheel the patient in any part of the frame, whether on the left side, right side, because it's removable, okay? So, there you have it. Okay, we are also going to provide patient exercise guide and the setup and use guides and the feet guide mat. Okay. Now, as you will be seeing all the features in the gait frame, hopefully at the end of the lecture, you will sort of like think that it is actually any therapist's dream machine. Okay, why I say that? Because first of all, I would not have to lift throughout the duration of my treatment session to the patient. My hands are free so that my hands can apply all the skill knowledge that I have for neuromuscular, tactile stimulation, manual placing of the limbs so that they can normalize the gait pattern. So there's a lot of things that you can do because as what is currently happening, the patient is being lifted, you know, by the arm or gait belt, so your hands are already occupied, right? And one thing good about this is the harness secures safety of the patient. What do I mean by that? It secures the patient's body through the harness and through the motor, and so the patient, being that they are no longer being handled on the left or handled on the right, there is now freedom of movement, right? So if we want to like really maybe exercise the upper extremity, they can move around. But with you holding the patient, it limits their ability to do the proper body mechanics or the biomechanics of movement. And when they are around the gait belt, they also don't feel secure because what if they fall and then you're small? So right? So and also when you use this machine, it makes the physical therapist more efficient. Okay, because you're able to like really use your time more evaluating, documenting, monitoring, observing, rather than really occupied with keeping the patient safe. Plus also, the patient will have the ability to like, move all the body parts that needs to be rehabilitated without being constrained by all the hands that are limiting the movement. And by the way, the gait frame is not only for standing. It has the ability to lower the straps so that you can apply a Swiss ball to position the patient prone or to position the patient supine, like if you're doing some abdominal exercises or core strengthening, or for extensor strengthening, and they can sit on a ball if you want to, work on sitting balance. And if they have balance problems, so we're not only just like restricting the medical condition requirements. Patients who have neurological deficits like balance, with this equipment you can perturb the patient's center of gravity, you can stimulate the patient's midline orientation, like if they're like having no awareness of where the middle is, you can do that, or you can push the patient and challenge the stability without the patient being scared because they're secure in the harness. Okay. We are also going to offer, along with the gait frame, some accessories that can be attached to the gait frame. So those attachments or rehab gadgets would actually be appropriate for maybe functional exercises, like for ADLs, like activities of daily living. So you are not really just confined to standardized exercise. Now you can do strengthening exercise program, functional exercise, stabilization. Okay, so you can really tailor exercise program that will best fit the patient's medical deficits, rehabilitation deficits. And I do home health visits, and usually in the States, when you go to a patient's home with the occupational therapist or the PT, we are limited to the number of visits. We're only like, we share the visits, so a total of like maybe 10 visits, 12 visits. So what happens after that if the patient still requires continuation of rehabilitation? So we can't do any more visits, okay? But with this one, if it's available at home, the patient can actually conduct or perform exercises every day, 2 or 3 times a day, 15 to 45 minutes or to tolerance. So knowing that, you know that the patient will recover faster, the recovery is sooner, and their return to functional and independent level is quicker, correct? Because if you're only getting visits like 2 to 3 times per week, as opposed to like every day, 2 to 3 times a week, 2 to 3 times a day, times 7 days, that's a lot. So it also actually supports the 4 principles and laws of medical and medical science and physics. One of those is the Wolff's Law. As we remember, the Wolff's Law is, when you apply pressure, repetitive pressure to a joint, it remodels the joint, or the bone remodels, and therefore it strengthens the bone. So that's Wolff's Law. And another one is like SAID, the specific adaptation to imposed demand. So, as the body gets, a pressure or weight bearing, it will improve in that level. So in the future, it will respond better for that kind of adaptation. And overload principle, because this is designed to promote weight bearing, you can increase as appropriate some load and some weight bearing to the left or to the right side, and therefore with overload you are allowing the body to increase strength, and then as the body gets used to that strength, you can break barriers and build again and more. So and the last principle is the reversibility principle. If you don't use it, you lose it. So continuing this kind of therapy program will help build up the strength that you want to build, whether upper extremity, hip, or knee. Okay. Do you have any questions? Okay, here's the accessory items that I was talking about, like the Swiss ball, bin bags, body blade. How many of you are familiar with the body blade? Okay, all right. I'm leaving that too, so please feel free to get the patient involved. I will make a demonstration later on. Okay, here's the machine. Okay, we're gonna go over that one by one later on when we go to the department. So basically, it was lightweight. It is lightweight. Earlier, I was here with Harsha, and I lifted the frame too. So if it needs to be moved around, you may do that, as long as it has to have an outlet. Okay, here's the harness. The harness would have some pockets to house the remote control, and also inside there will be pockets to for the body sensors. okay? And there will be a loop, but not on this harness now, but there will be a loop for the left and right side, because I was anticipating that if the patient would have some sort of hemiplegia, the spastic or the hemiplegic arm, that would be a concern for therapists, like somebody, like either a sling or you're handling it. So your hands will be free. There will be like a clip here and a wrist pad that you can position the patient this way, okay? So that there would be no subluxation on the glenohumeral joint. Okay, those are the accessory equipment. Oh. Okay, so basically, this machine mechanically lifts safely and lowers the patient from a sitting, and it sustains the patient in a standing position. And it eliminates the need for the patient to be attended by 2 or 3 physical therapists or caregivers. And with regards to the e-patient chart, we are now going to be able to collect, monitor, evaluate the patient's responses to the therapy session in real time. And that is also accessible anytime through your iPhone, iPad, or any tablet. And computerization provides measurable data about the patient's progress. So in the e-patient chart, you will be able to really appreciate the PT's documentation, because there will be like graphs as to how the patient is progressing, like in terms of muscle strength grade, a range of motion, like 90 degrees, increasing to 120 degrees, pain grade, and balance, the balance score. When you're recording or assessing balance, what do you use when you're assessing balance? The Berg, okay, Dinetti, yes. So those are measurable data, and if you use the e-chart, you document the initial evaluation, and then the progression of the patient during the whole program, and then at the discharge. So you will be able to see the graph where the patient is, progressing. Balance, gait scores. Do you also use gait score? Okay, all right. So that can also, because in America, it's such a big deal to have, whenever we're providing service, like a skilled service, it has to be evidence-based. It has to have measurable outcome. So this is something that we know that will work, because at least we know we are identifying that the patient is able to show some progress, not subjective, but a measurable tool. Okay. Now, just like what I said before, for physical therapists, the benefits are, you will be able to control their weight bearing, because just leave them in the harness and then you just sway them, whether you want them toe touch weight bearing, full weight bearing, or partial. And once they're up, you can actually do neuromuscular techniques, muscle re-education. For gait, there's plenty of things that you can do for gait training. You can manually place, the limb forward or backward, and you can actually use accessories to improve hip flexion, or stride length, or step length, okay, and or maybe some range of motion that's necessary for a gait if they have some, weakness in the hip, like a Trendelenburg gait, or like a hip height, things like that. So you can really concentrate on whatever you want to concentrate when you use this in-home gait. Okay. Patient benefits. Okay. They feel safe, and they have freedom of movement, and they can they can actually continue progressing their program as soon as they meet as soon as they reach a certain goal. You can now craft a new goal to progress the patient to a new level. Okay. Then the medical facility, the benefits for the medical facility is it actually enables the physical therapist to be efficient. Instead of 3 physical therapists treating 1 patient that requires maximum assist, the PT can attend to this maximum assist patient, and the 2 others can work with other patients. And for the facility, because it protects your back, so there will be no downtime for the facility because you hurt your back. And you also feel good because you're treating a patient who will not have any fear of falling, because we've eliminated that risk of falling. We've already tested this, as you have seen earlier. It will support a 260-pound patient. But keep in mind that this is different from a Hoyer lift. Okay, this is not designed to lift a heavy patient. This is designed to have the patient engage with you, participate in therapy. So you don't want a passive patient getting onto this one, because there's no rehabilitative potential for that passive patient. So it has to be an active participation of the patient who presents difficulty with balance, walking, and different problems. The video, the facility will be able to benefit from the video because it will be able to record the things that you're doing with the patient. Okay, so that's something that is available. And this is affordable because if you will look at some of the websites in America, there are machines that resembles this concept. But what is out there in the market is a huge tracking system where you have to really do structural changes in the department, because the tracking system has to come from the ceiling. And that costs $186,000. So that's a whole lot. But America, not all facilities have that kind of budget. So this one is really affordable, and it actually meets the same outcome as the huge, more expensive stuff. Okay. Okay. So I would like to get intimate with a machine, because there is a relationship between the body and the gait. When there's a problem with your body movement, there will also be some problems with your gait. And your gait is very distinct. Your way of walking is different from her way of walking. It's kind of like a thumbprint. You have a characteristic, your own distinct way of walking. So it needs to be evaluated, and when you evaluate the gait, it will be very beneficial for you to find out where are the deficits. Is it muscular? Is it neurological? So from there, you will be able to tailor exercises using this gait, and feel free to use your hands and apply all the skills and knowledge that you have in order to treat that gait problem. Okay, the normal gait is a series of rhythmical alternating movement, and these are some of the gait. Do you see a lot of patients that have gait problems? Okay, you think that it will benefit them to use this equipment? Okay, all right. Okay, now because the patient is up and erect in the harness, you will now be able to spend more time evaluating in the whole gait cycle. Heel strike, foot flat, toe off, stance, swing face, So that's the beauty. You now have the freedom to really look down, look up, look at the pelvic motion, look at the arm swing, look at the trunk twist, okay? So you can actually analyze and treat the whole gait pathology of the patient when you position the patient in the gait frame. Okay, the in-home gait frame supports what I believe the four important components in improving gait. That is posture. Okay, so when we're treating patients in parallel bars, we also are concerned about the postural awareness or the posturing of the patient. You cannot really progress or help patient achieve normal gait if the posture, is not corrected. So this in-home gait frame will help correct any excessive anterior trunk lean or a pusher, like a stroke who's uses a lot of extensor tone. So posture is one. You cannot really rehabilitate a patient's gait if the posture, for one, is poor. So let's start with postural, exercises. So that's one. And weight shifting. Because the gait frame is designed to provide or enable weight bearing, okay? Weight shifting, full weight bearing, repetitive motion of this weight, just like what I've discussed about the four principles, the Wolff's Law, everything about weight bearing. When you really promote weight bearing, as long as we're not treating fractured patients or dislocated joints, when you promote weight bearing, it stimulates co-contraction. Contraction and co-contraction to the front part of the legs, to the back part of the legs. So what happens now is you're stabilizing the joints, hip, knee, ankle, the whole kinematic chain. So when you're doing the weight bearing, what happens next is neuromuscular pathway. The patient is now able to initiate forward steps. With repetitive motion, repetition, you will be able to reproduce that most wanted initiation of forward step. Because even if the patient is like really, not mobilizing at all, but you concentrate on weight bearing because of those four principles, the neuromuscular pathway will be improved and the response will be forward steps. Now, the forward step may be just one or two, then repeat that. So until they complete that whole step length or stride length. Does it make sense? Yes, okay. All right. And the third important component is muscle strength. So you don't only want to address the posture, but also the weight shifting. And the third is the muscle strengthening. Where does the patient have problems? Is it the abductor because of the stroke, Trendelenburg gait, or is it leg length discrepancy? So you will be able to really evaluate, does the patient need some orthotic or some heel lift? So that's the beauty of it, because you're not holding the patient, you're able to really evaluate from the head down to the ankle joint. Okay, and so you can tailor specific muscle exercises for a specific muscle group that needs to be strengthened. And then balance, because we define gait as a series of rhythmical alternating movement. You have to have balance along with strength, along with posture, because without balance they will not be able to walk. They will be, but not steady. Not steady, so they're at risk falling. So I have vestibular discs that I would like you to use. I'm going to leave it here. So you will be able to challenge your patients in the gait frame using disc, like single disc or double disc. Feel free to push them, because, okay, no, I'm just joking. But what I'm saying is you can perturb the patient's center of gravity or challenge the balance because they need to also develop their reaction time, their protective extension reflex. So yeah, you will be able to use different rehab accessories to rehabilitate balance deficits. What other medical conditions that physicians send here for rehabilitation, like besides stroke, or what do you get most?
Spinal cord injury.
Oh, spinal, oh wow. Yeah, spinal cord injury. What do you do? Okay, at present time, what do you do with spinal cord injury? Standing frame. But then what's the standing block for the standing frame? It's just stationary, right? Because you want to challenge an SCI to, right, to move their lower extremity. That's nice. And then what else?
GBS.
Oh, Guillain-Barré. Nice. Okay. Oh, I'm so excited because maybe we can really develop data for the academic research. Oh my gosh. And what other medical condition? How many patients do you see a day?
IP, OP, both? Or
Outpatient.
All together.
all together?
Because you know why I say all together? Okay, this is why. This can be also used by occupational therapists. Yeah, so generally, like eyeball, like how many patients a day?
Somewhere around 150?
Yay! Okay, that's great. That's great. Oh, by the way, the harness, because we're particular with hygiene, right? Like, like they sweat or maybe urine or blood. Just make sure that when you use the harness, the harness is washable, okay, and it also can be wiped clean by any cleaning agent. But just be mindful that we need to control the transmission of germs. So if they need to be clothed, okay, do that before they engage in their body wrap, okay. But we're leaving one body harness, okay. So it's washable and it can also be cleaned by any cleaning agent. 150 patients. Oh, I love that. Okay. Amputees? Yeah? Okay. Multiple sclerosis? Oh my gosh. Okay. Parkinson's?
Yes.
Okay, that's good. But do physicians refer patients that are status post-surgery, like open heart surgery or total hip replacement, total knee replacement, cabbage? Okay, great, that's good. Here are the medical conditions. Yeah, head injury. Yeah. So we can treat these conditions. Joint replacement. Okay. I will go over this maybe in the department where the frame is. So we'll just have the actual field instead of here in the projector. Okay, so regardless of what medical condition the patient you're treating, these are like the major groups that you're really using, right? Range of motion, muscle strengthening, balance coordination, ambulation, and functional exercises or general conditioning. So that is, that's those are the areas that you want to rehabilitate. And these are some of the exercises that you can do with the in-home gait, like calf raise, toe raises, knee curls. Do you use a ball, a Swiss ball?
Yeah.
Okay. And like, how are they being used? Like, do you put the patient in a sitting position?
Sitting, yeah.
Sitting?
Yeah, even the prone, supine.
Okay, all right. It can also be done here. The strap can be unhooked and placed here so the patient can be in supine. It can be unhooked and placed over here to lay down prone. Okay.
But do we have that much space in the field? Patient.
Good question. So the exercise program has to be like within that frame. You don't want to design any movement that will be going out of the boundary. So if the patient is really debilitated, that's the ideal equipment because the patient is really not dynamic. So you wanna position the patient in prone or supine and really work on the core. If they're really debilitated, they're not really moving around so much. So they're still going to be confined in that space. Yes. But thank you, that's a good question. All right, there are barriers to the rehab outcome. So even if you're a very good physical therapist, but if the patient is not compliant or there are some barriers, that's still going to be like a challenge in meeting the plan of care or rehab goals, like depression. Do you get patients who have depression disorders or anxiety?
We get reference, but not much.
Oh, okay. But when you get those patients, how are they being treated? Are they just treated for rehab objectives and no mental intervention?
We have that usually it's seen by the
Psych nurse?
Psychologist and
Occupational therapist will take over ADL's part. The
Mm.
activity of daily living will be treated by occupational therapist most of the time.
I see. Okay. We move. And I really would love to collaborate with all of you. First of all, I'd like you to really feel free to use this frame to all of your patients with neurologic, orthopedic, or whatever problems, and collect as much information. We have prepared a questionnaire that will help us gather data and to complete our academic research. Okay, and if you have any questions, you will be able to reach me by Skype. Okay, I will be available anytime. I don't go to sleep. Now, there's 4 questionnaires: the pre, the post, and also the evaluation and the patient's lifestyle. Okay. So the preconditions for the patient for us to conduct academic research, we want to keep in mind, about their food and liquid intake. Are they alcoholic, or do they sleep enough, or do they have adequate rest? Do they have any problems with stress or depression? Like, did they have death in the family, or are there any problems with family relationship, things like that? Even if those problems are not meaningful to you, but you know that it affects the patient's participation level, or it will affect the outcome. Agree? Yes. And the elimination status, like the bowel movement and the urination and the medications. Are they taking, Lasix or cholesterol or blood pressure medication? For the user safety, I have mentioned before, if there's any fluids, okay, let's make a note of that. And also just make sure that the clothing will not have any loose or hanging or lengthy, it has to be safe before they get wrapped into the harness. And no food or drinks within that frame. It's done. Okay, so shall we go to the other section? All right. Okay. Yes. flow and also the harness that can be customized for the body type and the body size. Is this okay? Ladies and gentlemen, thank you for not getting bored. Okay, before I get on to this frame, I would like to also reintroduce Kevin, because we really need to also discuss the academic research portion of this gate frame. He's going to talk about the questionnaire.
What we'd like to do here is really to see if we have something that works. We think it works, but the fact is that before we launch the marketplace and sell it, we want to have the chance to go around and install the equipment and find out not only the works from the mechanical way, but also from a medical. So we're going to have you complete a questionnaire on a number of things. One is on lifestyle. So anybody who is a patient who is using the equipment, we want to find out a little bit about what they're doing, how they live, if they're ambulatory, if they're from a home in a hospital. From the medical side, we want to find out what type of condition and therefore what type of ordeal. But to have the exercises match up to what it is we want, we have to have a clear idea of what the outcome will be. Because all your work now will be monitored from the research that we're doing. And this is academic research which is now is work in the U.S. and Medicare. So this will be at the highest levels of U.S. medical industry and will be the first entry into it. So any information that you can give us which will advance what we're doing to show that this is something that really works when you work with a patient. It's one thing when we engineer it and design it. It's not something when you use it. And we've been able to work on it for a number of months now to find out all the issues. And we hope now as you work with it, you'll find out other things that we can help. We will have something in a form that you can make out. But that's going to go on to an iPad or an iPhone soon. So when you're working with a patient, you can just enter all the information. If you are now a therapist, I think what's going to happen is going to reopen all of your knowledge and you'll be able to see firsthand what we're doing. If you're students, it'll be a learning experience because now you can get into things which may be new for you, you can refocus on what you're doing, but we do think that it'll be a win-win for everybody. And we'll be open for anything you want as far as help using these forms and even as far as using the equipment. And we really feel now, Mysore now is the home of this. We have all of engineering here, and we want to make this a success out of many. And you can help. Okay?
So the data collection really plays a very important part because we're all in this together. So I really hope that with all of our dedication, like please, take your time to really fill out the questionnaire as best possible because that data is very critical for the academic research. And Dr. Raja will be in there for the academic research. And it will be very nice to be able to validate this equipment that you guys are using. May I borrow you? Okay. How much do you weigh if you don't mind me asking? Okay. All right. So pretend that you are debilitated. So we are, this is Dr. Raj's favorite. This is a transportable ramp. So if he is hypothetically a debilitated, I heard my name. Yeah, I told him that this is your favorite. Yes. So let's pretend that he is really debilitated, wheelchair bound. So we'll pretend that that's a wheelchair. On a wheelchair? Oh, okay, all right. So you're gonna get on the wheelchair. We are going to work as a workshop. So we're gonna treat him. We're gonna pretend like there's a clinical problem with this guy. May I ask your name? Swedish. Okay. Yeah. So this is Harsha. Apparently we only have one, but there's actually two. So two will in the wheelchair. All right. level, yeah, low level.
Power off.
Even if the muscle is like a 0/5, yeah, or like severe contractures, like if you want to stretch. Yeah, there is another layer of Velcro to secure as an additional safety feature. So, but there's right now we don't have the second layer. Okay. Pretend that you are, yeah. So I'm lifting this up and so this will be padded. Padded. I think we need to get a smaller patient on shot because it's not enough money for this level. Yeah, yeah. We need to get a smaller patient for now. No, because okay. All right. Okay. Okay. So we'll. Okay. So your
Go to class.
max, yeah, max assist, max assist.
Going to come out. Or tell that.
And we can use your upper extremities. How does it feel? Okay, because I want you to really put weight on your legs so that you're producing muscle contraction. Okay, and then you can do some weight shifting. Okay, there is also a horizontal bar that the patient can hold on to for added support. Okay, so now let's pretend that you are you're heavy. So yeah, you're single stand. Single stand. So just so you don't have to worry about him falling. So if he's only able to work on one leg and you need to recruit some muscle work here, either neuro or ortho, you can. He's not gonna fall. Okay, so now I want you to do some hip flexion. Knee up and down. And down. And then toe touch. Toe touch. Very good. And now shift your weight. Very good. Partial weight bearing. And then there will also be a camera that can capture this activity so that if you want to revisit your intervention with the patient, you have plans of doing something different on his next visit. And now he can take, all right, if he doesn't have like any dorsiflexion, okay, now you can work on some, like step forward, return, step forward, return. Okay, now if the patient, okay, now let's pretend that you are getting better with your muscle weight on both legs. Okay. Use the body weight. And you may also adjust, because the harness has a tendency, no matter how high-tech the harness is, there's always a tendency to slip up. So you just have to evaluate if you have to adjust it. Okay. Now this is the body blade. Okay, I'm going to also leave this in the department. It can be used for core strengthening. This. It can be used for a patient who has a momentum problem, like with bradykinesia, or like when the motion freezes and then it's very hard for them to initiate the motion again. So you can isolate the movement. You can tell the patient to stabilize this and just work on the arm. But you need to make sure that the patient is not wobbling. But if you detect that the patient is using a lot of motion, that means that they are really weak all over. So this is a great equipment. This is a great device to work on the arms, work on the abs, work on balance, even on mat exercises. Okay, you can do them. You can have them position quadruped and then do this. Okay, and overhead motion. So you can do a lot of things with this one. Even with this, I'm sorry, you have hanging there. And on the Swiss ball, if they are sitting on the Swiss ball with a harness, just be mindful of this. Okay, and Harsha. Okay, maybe. Do you have the Swiss ball?
Yeah, there is one.
Okay. Can you lower? He needs to